You may be required to wear a sling after surgery. You should remove this only as instructed by your surgeon. Your surgeon will tell you when you can stop wearing the sling. You may need to wear your sling for up to 6 weeks. Do not drive while you are required to wear the sling. Your surgeon will recommend the sling that is appropriate for you. The first type of sling we will demonstrate is an abductor sling. This sling provides support and will keep your arm in place. Place abductor pillow at waistline. Place arm in sling with elbow at the back. Connect forearm strap close to the elbow. Connect thumb strap. Connect waist strap to pillow. Bring the shoulder strap across your back. Place padding over shoulder. Connect strap clips to sling clips. Standard sling. The second type of sling we will demonstrate is a standard arm sling. Gently pull the sling over your arm and elbow. Your elbow should be at the back of the sling. Bring the shoulder strap across your back. Place padding over shoulder. Tighten the straps to keep your hand and forearm elevated above the level of your elbow. Attach the straps with the Velcro fasteners. Some slings have a strap that goes around your back to keep the elbow close to the body. If your sling has one, reach behind to pull around your back and fasten it near your hand. Make sure the strap isn't too tight. You should be able to fit 2 or 3 fingers between your body and the strap of the sling. For more information, visit bronsonhealth.com.